I learned from running the Recovery Act, you got to be hands-on. You got to get down to the detail because it really matters. And I think Jeff put together a hell of a team. And but we still have to, it's one thing to have efficiency, and we have to have equity as well.
That was President Biden last week talking about the road to recovery at a Veterans Medical Center administering COVID-19 vaccines. He was joined there by our next guest, U.S. Secretary of Veterans Affairs, Dennis McDonough. Great to see you in your new capacity.
Mr. Secretary, thanks so much for being here. The VA got $17 billion from the COVID relief bill. What are you using that $17 billion for?
Oh, good morning, Joe. And Mika, thanks for having me on this morning. The lion's share of that will be going to healthcare priorities, about $14.5 billion. That will allow us to ensure that the more than 9 million enrolled veterans in our care have access to the kind of care that they've come to expect, the excellent care they've come to expect from the VA. That will allow us to invest in facility upgrades. Obviously, with a pandemic like this, we needed to upgrade our facilities to zero pressure rooms, improving HVAC systems. But we also saw something really interesting during the pandemic, Joe, which is that upwards of 20 million appointments had to be changed or delayed. And then, of course, we see across the healthcare system, people have themselves chosen to not go in to get routine checkups and things like that. So this additional assistance will allow us to make sure that we can not only meet the needs today, but also meet the needs that may have been postponed over the course of the last year because of the pandemic.
Several years ago, of course, and I know you're familiar with this, several years ago, there seemed to be one crisis after another regarding a backlog at the VA, especially for medical claims, medical concerns. What is the status of that with you going in and running the VA now? Where are we as far as backlogs for medical claims and medical needs?
Well, there's two very important things that have resulted from the pandemic, Joe. First is a delay in some kinds of exams that are required for our vets to get access to the care and the resources or benefits that they need. This bill, this new law, the ARP, gives us several $100 million to make sure that we bring that backlog down. So that's the first thing. That's a backlog from the pandemic on certain kinds of exams. The second thing is a backlog on benefits claims, which has grown to somewhere around 210,000 cases. This is because personnel are not able to go into offices, for example, personnel from supporting agencies that help us get documentation to prove cases. We've got about $250 million in this bill to also bring that backlog down. So those are two important investments in this bill that allow us to bring the backlogs down. But let me just say one thing about the care at the VA, Joe. We're seeing remarkable uptake on vaccinations. We're seeing continued innovation at VA facilities across the country. That's a tribute to the VA. So these stories of the past, the crises of the past, are exactly that. We're going to stay on top of these issues moving forward, especially with this new funding from the president.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.